Welcome back. We're going to do a part 1 and part 2 video on hinged DME devices. This device that we're going to put on here is going to be a hinged knee brace, and this will be part 1 of the 2-part video series, and then part 2 will be the hinged elbow. The knee one we're going to do first because it's a little bit more complex. The elbow one, even though it's the same dynamic, it's a little bit less time consuming. So what we're going to do here in a moment, I'm going to, while we're recording, I'll go ahead and pull this out. This particular brand that we're going to demo, when you open the box, I'll come in close. When you open the box actually has a diagram on which straps go in which order, and also to the little components of the brace and how to break it down and all that business. So I will go ahead and remove it from the casing and throw that aside. This is the actual brace. Before I go into how to put it on and such, it comes with 4 straps. It comes with an adjustable lengthening tool on both the distal and the proximal end. You can either make the brace longer or shorter with this little knob right here. Unlock. There we go. And like so, it clicks into place, just like so. And we'll be doing that here in a moment when we apply this on the leg. It comes with all the padding attached with Velcro. We'll talk about this in a moment. And it applies on just like so with those attaching there. We'll go ahead and get into the specifics of that in just a second. I'm going to go ahead and have the patient lay down in a moment, and we're going to get started. Okay, so now we have the patient lying down. This pad we're going to talk about here shortly. This pad's relatively important, but it goes on in just a moment. When you place the knee immobilizer, in this case, it's not even, excuse me, the hinged knee brace is what it's properly called. There are a couple things you have to know. I'll come in close so that you can see. It comes with the adjustable dial for flexion and extension. The doctor's orders will tell you exactly where they want it. You'll notice that the 90-degree flexion mark is highlighted. That is one of the most common places the doctor will have you put the little adjustable bolt at, so that they're 0 to 90. They're 0 to 90 when they're using the brace. Again, it depends on the doctor's orders, the PT's orders, and if they're going to have it unlocked for use, or if they're going to have it locked for weight bearing. So we'll go ahead and unlock it for now, and we'll go ahead and start applying that. So I'll ask the patient to lift their leg for just a moment. Your goal when you're applying this, a couple of things. You want these circular pads to be right at the distal condyles of the femur, or in other words, the bony side parts of the knee. You want it just like so, and we're going to adjust it in just a second. You want to make sure that both the inner bracket and the outer bracket match. For example, this outer bracket is on B, and it goes up a little high on the patient's thigh, so we're going to bring that down. I'm going to put it at about A and a half, and I'm going to make sure the inner bracket matches. And then I'll kind of compare. So that looks good to me. And then we'll do the same thing on the bottom. The bottom one is set at B for the length of the shin. I'll go ahead and match the external one on B as well. So now we have the circular pads on both sides of the knee. Now what you do is you gather up the excess, let that rest on the good leg, make sure your measurement is correct. You want to take up the gathering from underneath, and this is the part where this pad comes into play. You want to apply this pad, which goes just distal to the patella. You want to apply this prior to cinching down all the straps. Lift for just a moment. You bring it all the way around the bottom, and there's Velcro to hold it in place, just like so. And if for whatever reason, come on down, relax. For whatever reason, as you're bringing it around, it's too long, some doctors will give you the permission to cut it. You get your scissors, and there's little markers here you'll see. There's little divots or little channels where you can cut if the doctor gives you permission to cut. In this particular case, this one seems to fit the patient almost exactly right. So I'm not going to cut that. I'm going to take my piece of Velcro. I'm going to lay that just distal to the patella. I am going to bring the outer bracket just like so, just to make sure everything looks nice and lined up. And now to get rid of the gathering of the straps, right here on the straps there is a little piece of Velcro to allow you to adjust the straps on all 4 brackets. You adjust all 4 of them so that the inner bracket, the inner brace, lines up. And make sure, this is kind of important, make sure that when you're gathering up all the excess that's in the posterior portion of the leg, make sure you don't pull too much in the beginning, in the onset, because what will happen as you're pulling up that gathering, this lateral brace, the outer brace, will start to go underneath. And remember, your goal is to keep these 2 circular pads completely parallel on the medial and lateral side of the patella. So if you pull too much in the beginning, you might have to go back and backpedal. So here we go. So right about there is pretty even. So then the order, these are supposed to go in textbook order, 1, 2, 3, 4. So we'll do it in that order for video purposes. Depending on the patient, that may not fly. You may, depending on the situation, post-op or whatever, you may have to start with another one first. I'll go through some of that in just a second. Out of all 4 brackets, you'll notice all 4 of them are identical. Well, there's 3 of them that are identical, and the one that goes right near the patella is a little bit different. You click that into place. You'll hear the click. On each of the brackets, I'll come in close so you can see. Each of the brackets, you'll notice it has these little grooves right here, these little teeth, and that's because when you're pulling up the tension, you want to pull with your fingers applying pressure there. You don't want to pull when they're connected to the teeth, because these little teeth right here, they rip very easily. And once you rip just one of these little teeth, the entire brace is ruined. So again, you see that I have number 1 clipped. Instead of yanking on it and completely destroying the brace, I'm going to put my fingers here to apply pressure, reverse pressure. I'm going to bring the brace in about snug for the first fitting, just snug, not super duper tight. You can always go back and make it tighter if need be. And here's number 2, and again, the Velcro comes undone. You can tighten it just like so. I'm going to attach it to the clip, the tooth, and again, applying my fingers, just like so. And then we'll go on down. Technically, the bottom bracket is usually put on the most snug so that it assists in keeping the hinged knee brace from sliding down the leg. And then the last one. You'll hear the click. You'll see the fingers applying reverse pressure, opposite side pressure, and that is your knee brace. And then you go back where you started with number 1. You'll see there's quite a bit of gap there. So then you come back and you adjust as needed. Check the posterior end too. Make sure there's not too much gap. If there is, like on number 2 here, I have a huge finger space behind the leg. So what I'll do is I'll unattach the buckle. I'll come over here to where the Velcro secures. I'll take it off of that buckle. I'll gather up what was loose in the back. I'll reattach, retighten, snug. And now you can get a finger and a finger. Again, the top one we have to revisit. I'll take it off entirely so that we don't ruin that tooth. I'll pull up the excess. I'll connect, retighten, and that, if I may, is how you put on a locking knee brace, just like so. And then, while I have it up close here, the dial has a locking and unlocking position on both sides. And again, like we talked about in the very beginning, flexion, extension, 0 to 90 or whatever the doctor orders. Sometimes if they're post-op, they'll start like 0 to 30 and then work their way eventually with each visit all the way to 90 until eventually they let them bear weight in an unlocked position. And if you stick around for part 2 of the video, we will demonstrate the exact same brace as it applies to the elbow without the medial bracket, without the medial dial. Okay, we'll see you on part 2.